Hello, I'm Dr. Charles Masarski. I'm an assistant professor of biology at Northern Virginia Community College in Annandale, Virginia. I am also in the private practice of chiropractic in Vienna, Virginia. In this video, I will be discussing the anatomy of the heart as it relates to congestive heart failure. My co-presenter will be Oxana, the cat. If you've seen some of our previous videos, you already know that Oxana has lived for centuries and has mastered several human languages. Oxana will be played by my wife and practice partner, Dr. Marian Todorus Masarski. With the help of the Faculty Resource Center at Northern Virginia Community College, we hope we have made this video entertaining as well as informative. And now, let's bring Oxana onto the set. Oxana? Oxana, come on out already.
Calm down, Doc. What are you, on the schedule? You haven't asked me what's new, so I'm going to tell you anyhow. I have a cousin Louie in Jersey. His paws have been swelling lately. Nothing else is swollen. He's just got fat paws.
You have a cousin Louie?
Well, I think he's a cousin. Maybe. May not be a relative at all. We're cats. Our family structures are anthropologically complex.
Anthropology is about humans, not cats.
Oh, great. A vocabulary lesson from the professor. Let's put it this way. Feline family ties are approximate. Anyway, in addition to cousin Louie, Aunt Sophie has a cough she can't get rid of.
Aunt Sophie? Another approximate relative?
They're all approximate. Pay attention.
Even your mother and your litter mates?
It's been so long since I've seen them. The exceptions that prove the rule. You want to hear what I have to say about your relatives? I thought not. Anyway, Aunt Sophie's vet has ruled out respiratory infection, allergies, and hairballs. He says Aunt Sophie and cousin Louie could have congestive heart failure. Is that something humans get too?
Absolutely. To better understand congestive heart failure, I first have to discuss blood flow to and from the heart. If you were saluting the flag, where would you put your paw?
I'd use a military salute like this. I was General Grant's cat, and my job was to wake him up in time for the Battle of Appomattox. So, you're welcome, America.
Sure. Thank you for your service, but you are not technically enlisted in the Union Army. You are a civilian employee.
Okay. So you want to see the way cousin Louie salutes? You want to see where he puts his paw? He's my Jersey boy.
No thanks, but you should use the civilian salute. Paw over your heart. Now, which side of your chest is your paw?
The left.
So, if I told you there's more heart tissue on one side of your chest than the other, which side has more heart tissue?
The left. You're going to keep making me say the left over and over again?
Not too much more. Now, the heart is a pump. It's a muscular organ. So if I told you one side of the heart is more powerful than the other, which side would that be?
The left. More muscle on the left means more power on the left.
Well stated. Now, if I told you one side of the heart pumps blood all over the body, and the other side only pumps blood to the lungs, which are immediately next to the chest, which is the side that pumps blood all over the body?
That has to be the more muscular, more powerful left side. The right side must be pumping through the short pathway to the lungs.
You've got it. The right side of the heart only pumps blood to the lungs. We call this the pulmonary circulation. The left side pumps blood all over the body to everything that is not a lung. We call this the systemic circulation. Allow me to do a little bit of amateur art. In reality, folks, the heart does not actually look like a St. Valentine's Day card, but in terms of a schematic, this will work. Left side, right side. The left side pumps blood to the entire body. So we would call this the systemic circulation. The blood returns to the right side of the heart, and then the right side pumps blood to the lungs. I'm not going to try to draw a lung because that would be a disaster. We call this the pulmonary circulation. From there, it returns to the left side. Okay, let's talk about cousin Louie and his fat paws. Sometimes the pumping action of the heart can become inefficient on one side. Several types of cardiovascular problems can cause this inefficient pumping.
Cardiovascular? I knew it. I've been telling Louie for years to stop smoking.
Cousin Louie smokes? How is that even possible?
He lives with a smoker. Every time his human puts down a cigarette, Louie takes a drag. He's been doing it for years.
Well, I think you're onto something here. Smoking is a risk factor for a high blood pressure and heart attack. Two of the problems that can render the pumping action of the heart inefficient. If it happens on the right side of the heart, blood backs up to the systemic circulation.
Wait a minute. I thought the right side pumps to the lungs, to the pulmonary circulation.
Yes, but congestive heart failure is about where the blood is coming from. The right side of the heart does pump blood to the lungs, but first, the blood has to reach the right side from the systemic circulation. If the right side is not efficiently pumping blood out, it backs up to the systemic circulation. This causes fluid to build up in tissue in various parts of the body. Because the feet and ankles are the lowest region of the body when we stand, sit, or walk, fluid tends to accumulate there, just like cousin Louie's paws. In some people, the swelling takes place in the abdomen. Tissue swelling from fluid buildup is called edema. Edema from right-sided heart failure affects tissues outside the chest, such as those in the feet, ankles, and abdomen. We call this systemic or peripheral edema. Let me add a little something to the drawing. So on the right side of the heart, fluid is coming from the systemic circulation. If it backs up, it is going to cause systemic edema. To give you a preview, if fluid backs up from the left side of the heart, it's going to back up into the pulmonary circulation, causing pulmonary edema.
Okay, well, what about Aunt Sophie? She's not the smoker in the family, but she's the one with the cough.
And Sophie probably has left-sided congestive heart failure. The left side of the heart receives blood from the lungs. If the left side of the heart is not efficiently pumping blood out, it backs up to the lungs. This leads to swelling in the lung tissue, which is called pulmonary edema. Someone with pulmonary edema can have a stubborn cough, even if there is no allergy or infection problem.
Well, Aunt Sophie could have both kinds of congestive heart failure. She's got a pretty big belly. Well, she does eat too much. Maybe she's just a chonk. Anyway, she sneaks out of the house sometimes just to beg for corned beef and pastrami at the deli on the corner. She's got a bad pastrami habit.
Well, it's not uncommon for someone to have both forms of congestive heart failure. The left and right sides of the heart can both be damaged. Also, if one side of the heart is damaged, that can put a great deal of strain on the other side. And yes, it is possible that her deli habit is involved. We'll get to that.
Oopsie. So how will my cousin and aunt get rid of this congestive heart failure?
I'm not sure how it works in veterinary medicine, but humans usually develop congestive heart failure after the heart has suffered permanent damage. So doctors usually don't cure it. They generally prescribe a combination of diuretics and anti-inflammatories to reduce the edema. Other than that, a heart-healthy lifestyle can help people cope with congestive heart failure as well as help prevent it. If you are a smoker, quitting is at the top of the list. In addition to that, one should get plenty of moderate exercise, such as brisk walking, and follow a heart-healthy diet such as the Mediterranean diet and other traditional diets. What these diets have in common is a minimum of red meat, some fish and whole grains, and plenty of fruit and vegetables. For heart health, salt intake should be minimized. So let me list some of this after I get rid of this beautiful art that I've made for you. So, heart health. As I've already mentioned, at the very top of the list, if you are a smoker, please stop. Increase fruit, vegetables, and moderate exercise. Decrease salt and red meat.
Aunt Sophie can eat an entire fish and wash it down with every plant in the house. She should be pretty healthy already, so what happened?
A little moderation would be helpful for Sophie. Avoiding obesity is another aspect of a heart-healthy life. Also, she should stop visiting the deli, or at least make it a very rare treat. I know this is sad, Oxana. Corned beef, pastrami, and other deli meats are high in salt, just what she doesn't need.
Well, Aunt Sophie's humans do all sorts of elaborate stretching and dancing and humming. She usually ignores them. Should she join in or just take her usual nap like 23 hours a day?
That sounds like yoga, tai chi, and meditation. Sophie should give it a try. These traditional practices are excellent for stress management, and someone with congestive heart failure needs all the stress relief they can get.
The humans in Sophie's house often use healthcare providers that don't prescribe drugs or surgery. Is that okay for Sophie also?
Alternative healthcare, such as chiropractic, acupuncture, and massage therapy, are not specific treatments for congestive heart failure, but they can help normalize the function of the nervous system as well as relieve stress. They can be helpful additions to the care of people with congestive heart failure. However, let me emphasize this point. These alternative practices are not replacements for medical care. They are best used as complementary forms of care along with conventional medicine. As far as non-human animals are concerned, the availability of alternative care depends on the regulations in your local area.
Okay, where can folks get more information? This sounds really important.
The articles you're about to see on the screen at the following links will give you a good start. I hope you found this brief presentation informative. Join us in thinking good thoughts for Louie, Sophie, and anyone who struggles with congestive heart failure. Until next time, be well.
Ciao.
Don't you mean meow?
It's close enough. I'm not on contract here.
Okay, ladies and gentlemen, before you go, try this short quiz to solidify your understanding of the material. The answer to each question will be true or false. After you respond, I will give the correct answer with a brief explanation. If the explanation seems unclear in any way, please view the video again. Number 1. Tissue swellings in the feet and ankles, or fat paws if your cousin Louie, is an example of pulmonary edema. False. Tissue swellings in the ankles and feet would be an example of systemic or peripheral edema. For a bedridden patient, systemic or peripheral edema may affect the lower abdomen. 2. A persistent cough unrelated to infection or allergy can be a symptom of pulmonary edema. True. Tissue swelling in the lungs, pulmonary edema, will cause a persistent cough with or without infection or allergy, or even without a hairball. 3. The left side of the heart is larger and more muscular than the right side. True. Remember how we salute the flag with our hand over the left side of our heart. That's an easy reminder that the left side is the more muscular and more powerful side of the heart. 4. The left side of the heart pumps blood to the lungs, the pulmonary circulation. False. The larger, stronger left side pumps blood to everything in your body that is not a lung. Another way to say this is the left side of the heart pumps blood into the systemic circulation. The relatively smaller, weaker right side pumps blood to the lungs, which are right next to the heart. 5. Congestive heart failure on the left side of the heart results in pulmonary edema. True. Even though the left side of the heart pumps blood to the systemic circulation, congestive heart failure results in a backup of fluid where the blood is coming from. It is the left-sided congestive heart failure that results in pulmonary edema, while right-sided congestive heart failure causes systemic or peripheral edema. 6. Smoking, high salt intake, fruits, and vegetables are risk factors and aggravating factors for congestive heart failure. False. While it is true that smoking and high salt intake can increase your risk for congestive heart failure and aggravate it if you already have it, fruits and vegetables are actually part of a heart-healthy diet. 7. A heart-healthy lifestyle includes avoiding obesity and adopting a lifestyle of complete rest. False. Avoiding obesity is important for many reasons, including its role as a risk factor for congestive heart failure. However, a heart-healthy lifestyle does not include complete rest. On the contrary, moderate exercise, such as brisk walking, is recommended. And 8. Chiropractic, acupuncture, massage, tai chi, yoga, and meditation are established, standalone treatments for congestive heart failure. False. Conventional medical care should always be sought to monitor and manage congestive heart failure. However, these alternative treatments and practices can be valuable as complementary health care with or without congestive heart failure.